Assalamu alaikum. Welcome back to another exciting episode of Poducation at Beaconhouse I-9 campus. I, Ayesha Nadeem, and Aniya Khan are your hosts for today. We are thrilled to have with us our distinguished guest, Dr. Muhammad Amir. He is the principal of Shifa Medical College. He is also working as a consultant general surgeon in Shifa International Hospital. Welcome, sir. Thank you for joining us today. What inspired you to become a surgeon?
You know, we always have to go back to our early education, and that's the time when you start feeling, okay, which profession in my career and in my life would suit me. In our generation, just to apprise you, we didn't have that liberty to think of ourselves as you are doing. So as I remember the day I have my memories in my mind, I was told that I'm going to become a doctor. It's not by my own choice, but this is something which I heard in my family. My elder sisters were saying it, and maybe my parents were saying it. But as I grew older and older, when I went to the high school and to the college, so I started liking this profession as well, because that is the time when I would go to a doctor and see how he or she is treating me, taking my symptoms, and advising myself as well as my own parents, my uncles, my aunts. And I started liking that profession very much. And when I was in the higher secondary school, that's the time when I decided that yes, I'm going to become a doctor. But choosing the specialty being a doctor, that whether I would become a surgeon or a physician or a neurosurgeon or something like this, that you usually decide when you go to the medical school, and then you pick up, okay, which part of the medicine will be most suitable for me. So that's the time when we go to the hospital as medical students that I decided that actually surgery is something which will suit my own instinct. Because in surgery, you see a patient, you diagnose, and you treat it, and most of the time you find a cure. In many other medical diseases, sometimes you can control them, but you may not be able to get a cure as early, as quickly as by doing some surgical procedure. So that's what is my inspiration.
So, what are the biggest challenges you faced in your work?
Yes, the biggest challenges are the diseases themselves. Then how the people are coping with those problems. So we have to strike a balance, because this is what we find in our community, that whenever a patient is brought to a doctor, he or she is accompanied by his relatives, his friends and families. And at one time you're trying to deal with the disease, trying to cure it. At the same time, the person who is suffering with that disease, you have to satisfy that, you have to counsel that. And not only the patient, but also his relatives as well. Because they are all in a lot of, you can say, psychological trauma they are going through, a lot of anxiety. So you have to address their question. So that's what I learned as a student and then as a teacher, that you have to have the skills of treating a disease, but as well as you have to develop a skill that's known as counseling or communication skill. If you are able to talk to the patient properly, humanely, that patients, what they say, that as you treat a patient, as your attitude is good, half of the trouble of the patient is gone already, because he is in a lot of stress. And if you try to relieve his stress, that is the first part of treatment. And then you actually deal with the disease and you try to cure that. So the biggest challenge is to calm down the patient who has come with a problem. That is most of the time we deal with that.
So, what are common misconceptions people have about surgeons?
The commonest perception is whether it's indicated or not, the surgeon will do surgery, because this is what he knows. It's a common misconception, I would say. Yes, there could be some instances where a person's own instinct might drive him to go to not the right path, I would say. But most of the time, as a surgeon, once you have achieved that cadre in your, or that profile in your career, you would like to treat the disease, and you will not do something which is unnecessary. But that's what the misconception in the people are, that they would try to avoid surgery because they think that a surgical procedure is something which creates trauma and it gives sort of pain. So why not try something which is non-surgical, which is without surgical procedure or operation, and that's what they would prefer that. But a disease which is to be cured by taking out that troubled part, whether it's a tumor, whether it's some infected part, and it's not curable or treatable by medicine, will never be cured unless you do the surgery at the right time. So the misconception is to either not to go for surgery or delay it as much as possible, and that creates problem.
What motivated you to teach in Shifa Medical College as well as proceeding in surgery?
Oh, I realized that if you are just doing practice as a surgeon, you do not grow up unless you teach someone. When you teach someone, when you make them learn something, that is what is the best sadqa-e-jariyah. That is, you are trained by your own teacher, and they trained you to become whatever you are, whosoever you are. So you have to pass it on to the next generation. And for the last 23 years, I am with the same organization. I joined as a young assistant professor, and now I am principal and dean of the same medical college. And that's how I have seen all the batches of students who have graduated from that college, starting from 2003 and even until now, 2025. So I have lived in Shifa College of Medicine. That is my life. That is my lifeline. And the students are, now they are bringing their own children to medical college. That is the best part of, the best feeling I can have in that institution.
Can you describe a particularly memorable case that you have worked on?
There would be many. If I try to recall one, it would be really, I have to, scratch my head and dig out from the thousands of cases we would have dealt with. And we deal with a challenging case and we think that's the best part we have done, and still there is another challenge to come forward to. So there are many instances. If I try to recall, the best part is you get a patient with a sort of a problem where I would have felt that maybe this patient may not make it because of the serious nature of infection, which was in the whole of his tummy. And we did it with what we call as a laparoscope. That is a very small endoscope. We put it into the tummy and try to remove all the infected parts. And after 3 or 4 days, he started recovering. So, and if I could see a smile on his face and the way he came 5 days earlier, that was the best part that you see in a patient, that he comes in a misery and with a sort of help provided by you, a surgical procedure which you have done to the patient, and he starts recovering from that. And if you see them going home in a happy way and cured of the disease, that is the best part you can enjoy in your life as a professional.
How do you manage the stress and pressure that comes with performing surgery?
We all have to go through a phase of training. So when you are young, you can cope with many situations, and you have seniors on top of you. So once you have supervising eyes like your parents, so that is the best trust, best advantage you have. So whatever you do, you try something, maybe you can do a mistake as well, but there are people who are there are your supervisors, your seniors, who are going to guide you. So you get a supervised, sequential training, and then you move forward. So similar is the case for treating your own stress. So you are stressful when you are trying to learn something new, when you are in a new atmosphere. So that is a normal physiological stress or anxiety, what you can say. But don't make it pathological. Pathological means don't try to put it on your head all the time and you don't deal with the situation. Yeah. So we learn it. That is part of our professional training, that we need to train ourselves how to deal with the stresses of life. And we deal with that. And surgeons are best trained to do that because they see patients in a lot of acute trouble, which they have to take them out of that trouble, whether it's an accident, whether it's a trouble of a disease or trauma of a disease. So we learn it.
So Shifa Medical College has welcomed students from Gaza. Who took this step and how do you feel about it?
Oh, that I think the recent best we can have. One as an institution sitting at Shifa College of Medicine, and the second as the Pakistani nation. If you could see the devastation which you see every day on the television, every day bombing, every day destruction, And probably you all have grown through this situation till now in the last 1.5 years. And maybe similarly, maybe you might not remember, but the person senior to you would remember a few years ago it happened again. So what could you do as students, as young people, or as nation sitting here? So that was the best part which we just got an opportunity to. So the credit goes to the government of Pakistan, to the High Commission of Pakistan in Britain, and many like-minded doctors across borders sitting over there who said, why not, out of this destruction, bring out the young talent who are already medical students over there and they have lost all hopes of education. Why not educate them? Because if you educate a generation. And we got the best lot here, about 40 students, and we are treating them, we are training them to become doctors. And as soon as they graduate, they will go back to their own area of Gaza. And as the physical rebuilding will occur, inshallah, so they are going to work in those hospitals, those hospitals that will be rebuilt over there. And that is the best part, best contribution we could give to that devastated nation. We trained them, we educated them, and they are going to take responsibility on their own. So that's the best part we can feel about them.
What are some of your hobbies or interests?
Yes, the biggest hobby is talking to the patients, trying to treat them. When I go home, so I enjoy my time with my kids. Okay, one of my kids was here as well when this branch started, and similarly, all of my wards, they have been educated at Beaconhouse, and I have lived through all their, childhood memories and enjoyed my time with them. But at a little younger age, I was fond of playing cricket and reading books and walking. So these are the hobbies I would still have.
What advice would you like to give to students who are aspiring to become a doctors?
Yes, the first thing a student who is aspiring to become a doctor really have to question himself whether he really wants to become a doctor, because this is very important. If you choose a profession out of compulsion by somebody else at the family and you are actually not into it, it may not be a good idea. Or especially in the current times, because of the demands of the society, because of the expectations from a professional as a doctor, it's a very, very hard profession. And one really has to make a judgment, make a decision. Yes, I would like to become a doctor at whatever cost I have to be. So that is the first thing that he really has to decide that he wants to become a doctor. But once he comes to our medical college, at the same time we are admitting students, those who are aspiring, last year, and they have been waiting to be admitted to medical colleges. We are in the process of admitting those students. So my advice would be to them every year as I talk to them on orientation, that the first thing, yes, you really want to become doctor, so decide now. And then you have to decide that it is a very, very demanding profession in terms of studies. You really have to work hard to study. There are so many, not the textbooks, so many areas of medicine. There are so many complexities of human being that first you have to understand the physical structure, then the mental structure, and then you have to study the diseases, and then you have to try to find out the ways to treat those. And there are so many questions still unanswered. So many diseases which are still not being treated the way they should be. So it's a lifelong learning experience and lifelong learning of skills experience. Okay. So my advice, as I would say for the younger students as well, that you really have to be focused on your studies. Yes, you have your co-curricular activities, you have your extracurricular activities, but the main focus for you would be to learn all the skills to become a good professional doctor. And the next advice, being a good professional doesn't mean that you are just a robot. You have to be a human being. And that is the next best advice I can give to any student. Whatever profession is choosing, but most so if he is going to become a doctor, because he is going to deal with the people, not with machines. Okay, and you have to talk to the people like a human being. Okay, you have to treat them like a human being. They are not machine. They are not like cars or other parts you are trying to fix them. They have all their sentiments, starting from a one-day-old child to 100+ years old person. They all have their feelings. You have to cater for them. You have to be a good counselor. You have to be a good communicator, and you have to be humane and human being before you can become a good doctor.
How do you communicate with patients and families before, during, and after surgery?
Okay, all these stages we try to empathize. Empathy rather than sympathy is something that you try to come to the shoes of the patient. See, if you were the patient, how would you feel? If you share the feelings of the patient, and that you learn throughout your journey as a learner, as a medical student, and then as a trainee. Then if you empathize with the patient, yes, whatever you are feeling, I have the same feeling. Yes, you have a pain, you have ache in your tummy. Yes, I know how does it hurt because I have also gone through it. Okay, we'll try to learn from your symptomatology, your complaints, whatever you are having, and try to deal with them. There will be certain areas which we will be able to fix now, and there will be certain areas of the disease, of the symptoms, which will cater later on. So similarly, I talk to the parents if for a younger patient, or to the sons and daughters if they are accompanying their parent, that yes, we'll try our level best to treat the disease. If we can cure the disease, if not, we'll try to control the disease. So there is a two-way communication, and I always ask them if there are any questions, if there is anything which you are still not sure about it, you have not understood well, please ask me again and I'll try to explain. So in your interaction, what you need to learn as a doctor, that give time to the patient. Patients usually feel if the doctor is in a hurry, he doesn't listen to them properly, doesn't answer their questions, doesn't satisfy their queries, then they sort of have a sort of a mistrust. They feel that they have not been treated well. So treat a patient well and talk to the patient well. A good communication is needed.
Okay, so what is the role of teamwork in a successful surgery?
Oh, there is no question about it. It's not a one man's or one person effort. It's a whole teamwork. And you know, strength of a chain of healthcare workers or anywhere is measured by the weakest link. So we'll have to try to fix the weakest link, because if you don't fix the weakest link, the whole chain of activities will just collapse. So we have a team of healthcare workers. So our nurses, our physician assistants, our trainee doctors, our medical students, each one of them, even the physiotherapists, all of them become a good team. And similarly in the operation room, our assistants to the operation theatre, they are also very important. The circulating nursing staff is very important, because they all have to give their piece of work to the best. And if they do it to the best, so starting from the patients coming to the institution, coming to the hospital and going home becomes an experience which he or she would remember, that yes, there were some people who tried to alleviate my ailments, my problems in a humane way. So teamwork is very, very important in any profession.
So how has technology impacted your field?
Technology has very, very positively impacted our field. What we used to do, like other professions, manually and take many hours and a lot of trouble to the patient afterward, we have been able to fix those problems with minimal invasive procedure, minimal procedure. So you might have learned about endoscopic surgery, laparoscopic surgery, even robotic surgery is now something which is there. In our own country, many centers have started that. All these technological advances are basically made to cure the disease, to treat the patient's problem with minimal of trouble afterwards. So if you make a big incision, big cut, so it gives a lot of pain after surgery. But if you try to do it with small holes and try to do the same disease control within the tummy, your patient wakes up well and he goes home early. So technological advance has made us to diagnose diseases early, at an early stage, treat them properly, and give the best possible, you can say, cure as well as comfort to the patient.
So what is the most rewarding aspect of being a surgeon?
The most rewarding is, the best reward in your life is what you do. You do to the best of your capability and you see a very, very positive result. So if your patient who came in a lot of pain, a lot of agony, and after the treatment, he smiles, so that smile is worth millions and millions. Okay, nobody can measure that in terms of any cost, any other measure. That's the best part. That's what human to human interaction is. That's what our race is different from all other, machines or robots or something like this, because we all have feelings. So if we as doctors also share the feelings of our patients and communicate with them properly, so the best part is sharing those feelings, and especially the feelings of happiness.
Thank you so much, sir, for your wonderful time with us. And that's a wrap. We'll meet you in another exciting episode of Poducation at Beaconhouse I-9 campus. And remember to like and share the video. Thank you.